are now up and live, and I didn't expect to be back briefing this week, but thanks to Dr. Khaldun for opening up the eligibility standards, we can move faster. But I want to start by doing something we probably don't do enough of and just say thank you and congratulations to the team. Today, the Detroit Health Department administered its 100,000th vaccine dose. Now, we started right before Christmas. This is an unbelievable accomplishment, and today they are doing 4,500 at the TCF Center alone. So to Hakeem Berry, who I think is becoming a well-known face of this operation, his right hand, Elisa Malia, who actually does a good deal of the work, and Denise Fair, whose health department outreach team has been in churches and homeless shelters and senior centers across this city, 100,000 doses. And for any Detroiter who is thinking, do I really want this vaccine? 100,000 shots have already gone into the arms of your neighbors. Please talk to them about their experience because it is positive. Today, we are expanding eligibility again. This is my favorite thing to do. And Dr. Khaldun, who I'm very proud to say came out of the city of Detroit and is running this for the state of Michigan, allowed us to do this. We've been wanting to do it for a while. But as of today, any Detroiter age 50 or older who has a chronic medical condition, you can call right now to the Rock Call Center. You can get an appointment, and you will be in and get your vaccine next week. We took this to age 60 a couple of weeks ago. It went very smoothly. But if you have cancer, you've got heart disease, diabetes, asthma, any other chronic condition, you can get a shot right now. And we've talked about this before, that a 50-year-old who's got heart failure is far more at risk than a 70-year-old who's a regular walker. And so we're starting to get to the point of reaching out to all of our most vulnerable residents. So when you show up at TCF, you're going to have to show some evidence of your chronic condition. It can be your prescription pill bottle, it can be a letter from your doctor, it can be an insurance form, something that shows the folks there that you actually have one of these chronic conditions. But we are now rapidly opening up the vaccines in this city. So when you call 313-230-0505, call right now. They are waiting to take this call. Let the operator know your qualifying condition, and then bring your documentation with you. And if you call right now, you might get an appointment on Friday. More likely, it's going to be next week. And so this is what we're going to do. The expansion of the manufacturing is going phenomenally well. We've had thousands of workers in the manufacturing side already calling and scheduling appointments. We are going to get this city reopened. And so before I go any further, I want to take a moment to give the folks who have been doing the work. I don't even have to worry about the outreach of the health department or the TCF operations. I've actually had time to work on the buses, which we're going to talk about in a minute, because the folks here are doing so well. But let me start by giving our folks on the job a chance to say a few words, and start with Hakeem Berry, our COO. Talk about how it's going over there today.
Thank you, Mayor. It is another great day at TCF, where, as the Mayor said, we're experiencing about 4,500 people come through to be vaccinated. And as we're talking about our 100,000th person that was vaccinated, I still recall when we first opened TCF, and the first person that got vaccinated, and the tears coming down their eyes because they were happy. And that is the energy that still exists today. It's been an honor and a pleasure to work with the great team that we have there that is still energetic to provide the service to the great people of Detroit.
Lisa?
Thank you, Mr. Mayor. I just want to say being out there is just an honor and a privilege to serve the residents of the city with our great leadership from our COO, Hakeem Berry, and just to our entire team. I mean, we are out there 12 to 15 hours a day. Their dedication, their grit, their hard work, we've become a big family, and I'm just so proud of everyone from the checkpoints to police to the nurses, the medical staff, our pharmacy staff, who are there every day serving the city. It's just such an honor to see that, and we are excited to vaccinate more, and thank you.
And one of the things that you may not appreciate, but is a logistical achievement, is now they are having to handle both Pfizer and Moderna vaccines at the same time. And the folks who get a Moderna first shot get their second Moderna shot 4 weeks later. Somebody with a Pfizer first shot gets their Pfizer second shot 3 weeks later. And when you're running 100,000 people through and making sure that the person who got the first Pfizer shot gets the second Pfizer shot, the level of controls you need is remarkable. There's a lot of places that will only operate with one vaccine or the other. When FEMA came in here and asked for our manual, they were amazed that we were running a high-volume center with both vaccines out of the same place. So for what you and your whole team have done, the other night I called Hakeem pretty late at night to talk about a different issue. I said, "What's all that noise?" And he said, "I'm still at TCF." So I said, "Wow, I figured you would be home by now when I was interrupting you in family time." He was still at the office. And the outreach effort across every senior center, every adult foster care home, every homeless shelter, it's been amazing. More than 2,000 homeless in this city have been vaccinated in our outreach as we have wrapped our arms around our most vulnerable. And I want to say thank you to the person who's led that, our health director, Denise Fair.
Thank you, Mr. Mayor. Administering 100,000 doses of this life-saving vaccine is a major accomplishment. What this means is that more lives are going to be saved, and we could not have done this without the support of our community partners. That's our clergy, who've opened up their doors to us for Senior Saturdays, our hospitals who are helping us to vaccinate, our community organizations who are organizing community pop-ups all across the city, our vaccinators and staff at the Detroit Health Department who have worked tirelessly to make sure that our most vulnerable are vaccinated, and of course our strong partnerships with the state. And so we say thank you. Now the road ahead is a long one. We have many more Detroiters to reach. That is why our outreach is so important, going out into the community and bringing the vaccine directly to our Detroiters. That's part of our commitment so that everyone can get this vaccine. So in addition to the TCF Center, I encourage seniors to take advantage of the Senior Saturdays at 6 locations all throughout the city. So whether you live on the west side or the east side or southwest Detroit, not only can you go to the TCF Center, but you can go to a church near you in a comfortable, trusting environment. So far, the turnout has been great. And if you are interested in coming this Saturday, you can call us right now, 313-230-0505. Get an appointment. Get vaccinated. And also starting next Saturday, if you're 50 and older and if you have chronic conditions, you'll also be eligible to go to the TCF, to this Senior Saturday as well. Finally, I want to remind Detroiters, as the restaurants open, they increase their capacity from 25% to 50%. And as the outdoor gatherings increase to a couple hundred, what has not changed are the safety precautions. Our infection rate is still low, right around 3%, but don't let your guard down. We have come too far. So I'm urging you to wear a mask, to wash your hands, practice social distancing, avoid large crowds, and please get vaccinated when you are eligible. And with that, I'll turn it back over to the mayor.
All right, and we have one more subject we're going to cover, and then we'll take questions. If we could get the president of the Bus Operators Union, ATU, Glenn Tolbert, to come join us. We have an announcement that has been a long time coming. So it feels like Glenn and I started off COVID together. On March 17th, I spent the day at the terminals when the bus drivers and the mechanics and the teams raised legitimate issues about the safety of our operators that led to us closing down the fare boxes, having the rear boarding, much higher cleaning protocols. But our bus operators have not had a pay raise since July 2018. And Mr. Tolbert has repeatedly pointed that out, and we've been working hard. And so I am very pleased to say that yesterday, the Bus Operators Union ratified a new contract. I'm going to take you through some of the terms of it and then turn it over to Mr. Tolbert. But here's what we've been able to do. So our drivers last got a raise July of 2018, nearly 3 years ago. Their base pay was at $12.99 an hour. As soon as City Council ratifies this contract, their pay will go up to $15 an hour. This is something that has always bothered me. I've always felt like the men and women who have responsibility for driving these buses should start at a living wage. And the maximum pay is now from $18.56 to $21 an hour, and we have a 2.5% pay raise per year for the next 4 years. So we got a 4-year contract. And so now we've got a situation where I think we're paying our operators fairly. We have had times where DDOT has trained really good drivers who have left us to go to SMART or to other organizations because of the pay. That wasn't a good situation. The other thing is we've had very high absenteeism rates, and while we could debate the cause of it, this was an example of the unions and Michael Oglesby and the DDOT leadership sitting down and working together. We've got a new program that I am confident will dramatically reduce the absenteeism and provide better service on the road and pay our men and women fairly. And with that, I'll turn it over to the great leader of the ATU, Glenn Tolbert.
Thank you, Mr. Mayor. This has been a long time in the making. We started this in November of 2018 with my predecessor, the late President Fred Westbrook, and this has just been a hard-fought road. My team and I have worked tireless hours with Hakeem and Mr. Oglesby when he came on board, and some other administrators. We're glad to be putting this chapter behind us. We're finally being brought somewhere up to where we think we should be, with the men and women in the region. So, having said that, I'm looking forward to getting on with the next chapter, making sure that the safety protocols and things as far as the COVID and, Mr. Hakeem and I talk about this hazard pay. So, I'm steady working. We're going to be steady working, and we're going to steady be talking about it until this thing. Every time I wake up every morning, there's a new variant. So, I don't think we're out of the woods. So, I do look forward to the fare box opening back up. I believe it's time. But however, it does bring a new danger, and so we'll be looking into that and talking with the administration. They've been very cooperative or willing to listen and do what they can to help us. So I thank the mayor, I thank Hakeem, I thank the mayor for calling us. I guess he said this is going on too long. Called us and asked us to come talk about it. We were not that far off. There were a couple of items that took us 3 years to hash out, so I'm glad that we were able to work it out.
The tension that has existed between DDOT management and the unions is something that I have not been very happy about. But since the new director of DDOT, Michael Oglesby, came in, it has started to change. And I think almost from the time he got here, we were on COVID lockdown, but he has done an absolutely outstanding job and was a key part of putting this together. And Michael, why don't you talk about what this means to the future of the organization?
Well, thank you, Mr. Mayor. The future's bright. We're really excited to move into the next chapter of transportation in Detroit. I'm excited. I've had long talks with Union President Tolbert, and we both agree that in order to do that, the right thing has to take place, and I think it has. The pay is where it needs to be. The safety of the operators is our number one goal, to make sure that we have the barriers in place and to make sure we have all of the protocols in place as we move forward to collect fares. And we're going to monitor this, and we're going to monitor it together as a team. This is no longer management versus the union. That's all out the window. We're all working together as one, and we all have the same goal. So we're going to take this, and we're going to run with it. And I'm very excited with the next steps, Mr. Mayor.
All right, and Hakeem Barry, who in his spare time negotiates labor agreements, and late one night over dinner, we hammered this out with the union, and Hakeem came and joined us after his shift to TCF. And, you know, right now, we got to be able to do more than one thing at a time. And I'm really proud of the men and women of the city of Detroit. With that, we'll take any questions.
Thank you. I'll keep it brief. When you talk about fight for 15 or $15 an hour, I'm just curious, using this time as a reset for where you're at in regard to supporting this fight for 15 minimum wage, whether you think it'll happen now as part of this $1.9 trillion aid package that's being debated. Just kind of use the moment to reset what your thought is on that, if you would.
Yeah, I do support it. I worked really hard with SEIU a couple years ago for the workers on the various janitorial jobs, that they got a contract that brought them to $15 an hour by the end of their term. And we have some pay scales in the city of Detroit that need to be brought up. At the national level, I do support the $15 an hour minimum wage. You look at the nuances of this. The Senate parliamentarian has ruled that it cannot be part of this current bill under the reconciliation rule, so it's something that we're going to have to come back on. I know the president is committed to come back on a bipartisan basis. But this is, in our case, in a case of leading by example. And I know President Tolbert said to me, our starting drivers got to make $15 an hour. I said, I agree with you. But we also have to have drivers who are regularly attending at work. And he said, that sounds like the basis for an agreement. And we sat down and worked it out.
Appreciate it. The other is back to COVID, and it's for anyone, please, Hakeem or Denise, too, about, you said all the right things as far as reiterating, not giving up, don't let the guard down, et cetera, but yet we have a landscape where Texas is happening now. I believe Mississippi's governor is considering it. And there's a lot of people in our community I've run into at events that don't mask up. It's just making it through the final couple of 3-4 months here, whatever we have. I'm just open to your thought when we see other states, not to necessarily opinionate on them, go in a different direction.
Our governor has been phenomenal over the last year. She has stood her ground. She has focused on the data and science to drive her decision-making, and that's why we are where we are. Our mayor has also been phenomenal in making tough decisions, and I think that is why we are at a low infection rate. And so our focus is on the city of Detroit, and I think we are headed in the right direction. Our focus is bright. Our focus is on making sure Detroiters have access to the vaccine, and not just equal access, but equitable access. I think I feel really good about the direction that we're heading.
And we want to open the city back up. And the faster folks sign up for vaccines, the faster we open the city.
Appreciate it. Thank you.
All right, Mayor, we've got a number of questions from some reporters that are watching remotely. One is, I think, just to restate regarding the new age limits for Senior Saturday. If you are 50 years and older with chronic illness, you are able to go to Senior Saturday,
Yeah,
correct?
they'll schedule them into Senior Saturday if you'd rather be at one of the churches.
Okay.
Anybody 50 and up. We've redefined seniors at 50. I'd probably make some people unhappy. I'm far beyond it mattering to me. But Senior Saturdays will be for everybody 50 and up.
Okay. We have a number of questions regarding Johnson & Johnson. Christine Ferretti points out that at a recent briefing, you'd suggested that the Johnson & Johnson vaccines could go to rural areas as opposed to Detroit, and wanted to know what prompted the change in that respect, and are we concerned at all that adding another slightly less effective vaccine to the supply would discourage residents who might have some hesitancy in getting the vaccine?
I haven't changed at all. So Johnson & Johnson is a very good vaccine. Moderna and Pfizer are the best. And I am going to do everything I can to make sure the residents of the city of Detroit get the best. And so, as you know, I went to the White House, got a commitment for 15,000 a week of Moderna and Pfizer. We've been enlarging it, and this week we've got 29,000 Moderna and Pfizer vaccines, 17,000 first doses, 12,000 second doses. Those Moderna Pfizer vaccines will cover every single Detroiter looking for a shot. Next week, I expect us to have between 25 and 30,000 more Moderna and Pfizer vaccines. And again, I believe we will have a Moderna and Pfizer vaccine for every Detroiter who wants one. The day may come when we have more Detroiters asking for vaccines than we have Moderna Pfizer, in which case we'll set up a Johnson & Johnson site. But I'd say for the foreseeable future, I feel confident that we will have a Moderna and Pfizer vaccine for every Detroiter who wants to get vaccinated.
Okay, and a follow-up from Christine Frey. She wanted to know if, by not accepting the Johnson & Johnson vaccines, did any Detroiters miss out on an opportunity to get vaccinated?
Again, I don't know how to say this any clearer. We got 29,000 Moderna and Pfizer vaccines. That covers everybody who wanted a vaccination this week. And so if we can cover everybody in Moderna and Pfizer, we're going to do that. So if you take what Hakeem and Elisa are doing over at TCF, they max out at 5,000 cars a day. There is literally no more parking spaces. So 25,000 of the 29,000 will be administered over at TCF, 2,000 at the senior Saturdays, and 2,000 in the health department outreach. So at this point, everybody in the city of Detroit who's eligible, who wants a vaccine, can get one. To my knowledge, we're the only place in the country where now, if you're over the age of 50 with a chronic condition, or you work in manufacturing, you work in grocery stores, call right now. You'll get through in a matter of a few minutes. You'll have an appointment within a few days. Every single Detroiter who wants a vaccine has a Moderna, Pfizer vaccine available to them right now.
Okay. Christina Hall from the Free Press wants to know if we know yet when the next round of Johnson & Johnson would be coming to the city.
Yeah, we don't know. I'm going to say this as best I can. The Johnson & Johnson vaccine is a good vaccine. 70% of the time, if you get it, you won't get COVID. And if you're in the 30% that do, there's a very good chance it's mild and you won't be hospitalized. If you get 2 shots at Moderna and Pfizer, there's a 95% chance you won't get it, and the 5% who do is a very good chance it's mild. The problem is that with Moderna and Pfizer, you got to get 2 shots. And so as a city, that's really complicated. It's complicated to schedule somebody, move them in, get them in a shot, take care of them, get them out. And to do it twice is twice as much work. In this city, I think the relative improvement in your health protection is worth us doing twice as much work. And so because you have the good fortune to live in the city of Detroit, where you've got a TCF operation that will schedule you twice and put you through twice, you're going to get a chance for the higher level of protection. The day may come in March or April when every single Moderna and Pfizer is committed and we still have people who need a vaccine. And at that point, we'll set up a Johnson & Johnson center. I don't see that in the next couple of weeks.
Okay. One question on a slightly different topic, still COVID-related. Olivia Lewis from Bridge Detroit is saying that they're hearing that Detroit is vaccinating as many non-Detroiters as Detroiters, and wants to know if there's anything to that.
Yeah, I don't know, we've got the numbers, but it's probably about 2/3 Detroiters. So everybody who is 65 and above is a Detroiter. We also vaccinated 7,000 school teachers. Probably half of the 7,000 school teachers were non-Detroiters. I don't have any hesitation about that. They're taking care of our children. But everybody who has come through has been eligible, but it's probably about 2/3 Detroiters, 1/3 non-Detroiters, and the non-Detroiters are people working in our grocery stores, taking care of our children.
Okay. That's the last question we can respond to. I'm just going to let Kate Wells from Michigan Radio know that we'll get to her question afterwards. She's wanting also to know some numbers behind the data, percentages on the dashboard, so we can get that.
Okay, yeah, Denise has all the numbers that anybody could possibly want.
Yeah.
All right, well, I'll let you guys get back to work, and thank you very